Thursday morning, June 22nd. It is 8:13, second day of summer. We're talking to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. How are you, Dr. B?
Hey, Tommy, I'm doing well. How about you?
I'm okay. Were you there with Newell yesterday or not?
No, not yesterday.
Okay. We were talking about, and a quick note about that, about Medicaid. I saw Newell tweeted something earlier about checking your Medicaid eligibility, right?
Yeah, absolutely. It's critical right now because you don't want to lose that coverage.
You can go back and listen to it if you download Odyssey app and use the rewind feature, or go to WWL.com. You can find out all about that. Right now we're talking about migraines. Migraines affect more than 37 million Americans. I'm one of them. And lead to more than 1 million emergency department visits each year. But fewer than 5% of people with migraines have received a proper diagnosis and care. And Dr. B from People's Health is going to talk about it right now, about migraines and tips for managing symptoms. And I guess, Dr. B, first thing we're going to start with is the definition. What is a migraine?
Yeah, sure. You know, when most people hear the word migraine, they immediately think of just a really severe headache. But migraines themselves are actually a neurological disorder. So what that means is that they're a health condition that affects your brain. And headaches are really only one symptom of what migraines can actually do.
What are the other symptoms of migraine?
So, yeah, like I said, you know, the main symptom is going to be a headache, and usually it's going to be on one side of your head, although that can vary from person to person. And a lot of people describe it as a throbbing or a pulsing sensation, but definitely very severe. A lot of people, though, can have other symptoms. They can have things like fatigue. Some people will actually get nauseated and may even vomit. They can have loss of appetite. Some people will even have sweating or chills. A lot of people can be sensitive to light and sound in particular, and it can cause dizziness or even blurred vision. And, you know, the symptoms typically get worse when you're more active, or they can get worse when you're exposed to either an intense light or sound. And for some people, even a smell, so a real strong smell can actually trigger or make one of those headaches worse. Typically migraines are of a severity that they really affect our ability to do daily activities. In fact, about 90% of people with migraines say that it interferes with their ability to go to school, work, or really interact with other people.
Are migraines all the same, or are there different types?
No, there are a bunch of different types, and in particular, we kind of categorize them into two main areas. There's either those with or without an aura, and what an aura is really, it's a visual or a sensory disturbance that can occur with the migraine. Auras typically can be issues with speaking. It can be when you see flashes of light or maybe have blind spots in your vision. Some people can actually experience numbness or tingling on the face or arms or legs, maybe only on one side of the body. So it can be really concerning if that happens. About 15 to 20% of people will experience an aura. So the other 80% are without an aura completely. And the auras may not actually occur with every attack. The thing about them, if you do have one, is they often start about 30 minutes before the other symptoms come on. So they can be a warning sign of a migraine that's about to occur.
What are some of the risk factors when it comes to migraines?
Yeah, there's several risk factors that, really kind of make you more likely to have migraine. One of the biggest is actually what sex you are. So women are 3 times more likely to have migraines. There's also a very heavy genetic component. So if you've got a close family member who's got migraines, you're much more likely to develop them at some point in your life as well. And then age can be a risk factor too. And unlike a lot of other conditions that develop as you get older, migraines can occur really at any time, but they tend to occur when you're younger, maybe in adolescence.
Really?
They can act. Yeah, it's kind of interesting. It's a different type of disease. They also tend to peak in your 30s, and then over time they can become less common. So as you get older, unlike diseases that get more prevalent, this one actually gets a little less prevalent as you get older.
Do we know what causes migraines?
Yeah, there's a lot of studies, and actually some things we thought have been disproven. So we're not entirely sure what exactly triggers them. Almost anything can cause someone to develop a migraine, but it's difficult sometimes to pinpoint, what that is, and the triggers are going to vary by person. Some of the most common triggers, though, for migraines are things like stress. Definitely. If you have poor sleep habits in particular, too, if you're not getting enough sleep, that makes it more likely that you could have migraines. I mentioned smells before. A lot of people can be sensitive to certain smells. You may walk into a restaurant and suddenly develop a headache. That could be a migraine. And then things like loud or sudden noises, booms, crashes, things like that can trigger. Light has a really strong effect. Remember, again, it's your brain that's having the issues. So when you're exposed to a really bright or a flashing light, that can actually trigger something. And then a lot of people have trouble with weather changes. So when we have a front coming in and the pressure changes, that can actually cause headaches as well. And then one in particular is caffeine and alcohol. So too much caffeine and alcohol can actually cause migraines too.
So that's a lot. How can people kind of identify what potential triggers they have?
Yeah, it can be tough because there's so many things that can, cause a migraine to come on. And so what we tell people to do is to really keep a headache journal or a migraine journal. It's a really great place to start, and it sounds silly, but it works really well. What you do is, just have a little book. Every time you have a migraine or any of those symptoms occur, you want to make little notes about what you were doing when it happened, where you were, what you maybe got exposed to before the symptoms actually started. And then what it allows you to do, and when your doctor looks at that journal, they can sometimes notice a pattern that can help us identify those potential causes. You want to make sure you put dates and times, because if they're happening more in the morning versus the afternoon, that could be a different cause. You want to definitely list what your symptoms are, especially if you have an aura or you don't, and how severe they are. And then definitely how long they lasted is important, and what you did to try to treat them. Did you take something to treat them? Did you, go somewhere cold and dark? You want to make sure that you kind of document all of those things so that we can identify what may be the best way to treat you.
Those of us that get migraines can identify with cold, dark, and quiet. That's what you want. We'll talk about treatment of migraines when we come back. We're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about migraines this morning. 8:20, traffic now, WWL. 8:25, quickly back to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about migraines affecting 37 million Americans each year, more than 1 million emergency room visits each year. But fewer than 5% of the people that have them have gotten a proper diagnosis. Let's talk about treatment, Dr. B. How can you treat migraines? What can they do?
Yeah, fortunately, we can treat them because they can be so severe. We can't cure migraines completely, but there's a lot of different ways we can manage them. So, for really mild migraines and occasional migraines that you may have, often over-the-counter medicines may help. So acetaminophen and ibuprofen, and there's even some combinations of medications you can buy over-the-counter that may even have a little caffeine in them, can help with that. If they're more severe or they're happening more frequently, prescription medications may be necessary. So you want to talk to your doctor really about how to manage the pain and determine what's going to help you. If you are having really frequent migraines, maybe daily or every other day, you may even need to take medicine prophylactically, so every day to try to prevent those. But again, speak to your doctor. They're going to recommend the treatment based on your symptoms and your history and any other medications you might be taking as well.
You got any tips for managing migraine pain at home?
Yeah, absolutely. At the first sign of migraines, and it sounds like the first thing you want to do is take a break, step away from what you're doing, and like we were saying, really a cold, quiet, dark room is probably the best place to be with your eyes closed. What you're trying to do is decrease that sensitization and the things that could actually trigger or make a migraine become worse. a cold compress on the forehead or a little bit of ice may help as well. And then what's really important for migraines is make sure you stay hydrated. Migraines get worse when you get dehydrated, especially during summer months like we have here. So you want to make sure you're drinking plenty of water, not necessarily all caffeinated drinks, but small amounts of caffeine can actually help relieve migraines. But be careful, because too much caffeine can actually lead to withdrawal headaches, which is a whole other problem. So you don't want to go overboard on the caffeine.
Can you change your lifestyle in some way that would help?
Yeah, definitely. Just like any health condition, it's really critical to maintain a healthy lifestyle. That's just as important in managing your migraines. And so you want to make sure that you exercise regularly. Exercise can reduce the chance of migraines. Diet is very important in particular, because there are some foods that can trigger migraines as well. So make sure you're eating a healthy, nutritious diet. And then, like I had mentioned before, sleep is really critical. You want to make sure you're getting a good 7 to 9 hours a night, and you're consistent in when you go to bed and when you get up. And then the other thing is really a huge trigger for migraines is stress, like I was mentioning. So you want to try to lower your stress levels, and there's a lot of ways you can do that. Spending time with your friends and family, as long as that doesn't cause you stress. And trying relaxation techniques, things like meditation or Tai Chi can be very helpful. And then try to distract yourself. Do hobbies, something you really enjoy, reading or, anything that you really enjoy doing can help get you out of those triggers that actually make migraines worse.
I had my entire family over on Christmas Day, and they were watching Ben-Hur cranked up as loud as it could be because some of them, it's a true story, Doc, and I had to go lie down in the dark because it triggered the migraine. It's like, I got to go or else I'm going to throw up. When it comes to water, a lot of people are walking around, and I got to thank Jordan Fiegel, our producer, because he helped me with this, dehydrated, and they don't really realize it, huh?
Yeah, definitely. I mean, especially when it's so hot out like it is now, you don't realize how dehydrated you can get very quickly. So carry one of those water bottles around with you. Fill it up frequently. If you're not going to the bathroom regularly, you're probably dehydrated. You may not even realize it. And that could trigger these migraine headaches.
It makes a heck of a difference. You'd be surprised. Thank you, Dr. B. Valuable information. We appreciate it.
Thanks, Tommy. Talk to you soon.
You bet. Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. You can find out more about People's Health if you go to peopleshealth.com.